Oral cancer screenings are super important, especially in Kentucky. We have some of the highest oral cancer rates in the country. It's scary stuff, and it progresses really quickly. And so it's very important to come in every 6 months, every 12 months and get checked and just make sure everything is happy in there, because you don't want to let that take off on you. Family loves you and they need you around, and for us it's important to contribute to that.
As far as the oral cancer screening, I do oral cancer screening on all my patients, and I let them know that I'm doing that. Mainly, obviously, if you're a smoker or if you drink alcohol, you are at a higher risk. Also, if you already had a history of oral cancer, that means you're at a higher risk again. And with smoking and alcohol, it really depends on the intensity and frequency, how much you are drinking and for how long you have been drinking. That puts you at a greater risk. The oral cancer doesn't hurt, it's just there. So any kind of ulceration that doesn't go away in 2 weeks or so, or you don't know for how long it's been there, or you don't know why it happened, if you don't have a history of trauma, or you don't remember, if you actually hurt yourself, you should get that checked out. If you feel that, oh, this lump comes and goes and it's not always there, that's another indication, that's another thing that it might be an oral cancer. And if you are especially making your regular dental appointments, it might not just be a cavity, or might not just be a draining tooth, it might be oral cancer.
I provide an oral cancer screening at every visit for my patients coming in for their 6-month recall, cleanings, and checkups. What that entails is an exam visually of all soft tissue, hard tissue areas, and I will check underneath of the tongue, the floor of the mouth, the throat, the common areas where oral cancer tends to be. I always recommend that if anybody, especially somebody with high risk factors such as a family history, smoking history, or other tobacco use, if you ever have a suspicious area, a ulceration that does not go away, any sort of white spot that doesn't heal, then to immediately have those areas checked. So, I do provide oral cancer screenings at every periodic and comprehensive exam visit.
What would you say about oral cancer?
Oral cancer is something that's not to be taken lightly, because it does tend in many cases to advance quickly, and because of where it's sited, where the situation is, it can get to a lot of very delicate places very fast. So oral cancer is something that all dentists will be concerned about in terms of examination and screening, and also following up with proper referrals if that's needed. These are the most important things that people need to know about oral cancer. Is if there's just like a rough edge can be an irritation, and those kinds of irritations can cause situations that are a little bit leaning the patient towards a cancerous situation.